Everyone experiences burnout at some point, and now one doctor explores that feeling of burnout specifically among healthcare workers. Fox 13 News reporter Spencer Joseph has more.
The medical profession has been hit hard over the last few years, especially with the COVID-19 pandemic still going on. Dr. Joe Allen, a professor of industrial and organizational psychology at the University of Utah, wrote a book documenting the level of stress and burnout among medical professionals.
The book actually pivoted during the pandemic from being just about the situation we were already in to the new situation that COVID presented with way overwhelmed medical workers who, as we know, have been quitting, have been leaving the profession because it's killing them.
Allen says medical doctors are doing what they can to maintain themselves during periods of high stress.
So basic things, basic health related things that doctors tell us to do as patients, they are trying to do themselves, like eating healthy and exercising and finding ways to properly recover from their busy day, building up their resiliency, building up their personal resources to deal with difficult situations that they run into all the time with patients.
However, Allen sometimes says that's not enough.
The problem is, even those who are doing these things, the system itself and the patients that they interact with is overwhelming them. In other words, they can only become so resilient.
Creating a more human experience for doctors will help incentivize being in the profession, according to Allen.
So incentivizing becoming a doctor and creating a more humane experience for our doctors so that way they can adequately care for their patients, not be worried about making errors because they're 100%, so they know they're not going to make them, right? Instead of being burned out and worried they're going to make them.
He also says voting can make a difference.
It has to also be about making it a better system so that way the doctors can see the patients for a long enough time to actually help fix them, and that the patients can get the care that they need. Because right now, that's one of the main reasons doctors are leaving, is the burnout that comes from them feeling like they can't care for their patients the way they want to.
In the end, Allen says he's hopeful for the future of doctors.
We can fix this, but when I say we, I don't mean the doctors, I don't mean the nurses, I don't mean the patients, I don't mean the legislatures, right? I mean everybody. We collaboratively can fix it, but if we try and put it on any one of those groups, it can't be fixed because it takes a collaborative process in order to solve a complex, what we call in the business, a wicked problem.
Spencer Joseph, Fox 13 News, Utah.